p.m. on Tuesday, April 7th, 2020. Thank you for joining us. This is Janet Hill. I'm the Chief Operating Officer at the Rock Island County Health Department. Today we are joined by Nita Ludwig, the Administrator of the Rock Island County Health Department, and Ed Rivers, the Director of the Scott County Health Department. We do not have prepared statements today, but we are here to answer your questions to the best of our abilities. As we have asked for several weeks now, please type your questions into the chat box, and Brooke Barnes will lead the moderation of that. Nita, will you please start us off today?
Sure, thanks, Jana. This is Nita. We today have 9 new cases reported to the health department for a grand total of 60 positive cases in Rock Island County. All of the cases today are on home isolation. We do have 4 people that remain in the hospital, and we have unfortunately reported the death of 1 person, a male in his 60s, who was hospitalized. And certainly our thoughts and prayers are with his family at this time.
Ed, would you like to describe the numbers for Scott County?
So the count today is 66 from the Iowa Department of Public Health website. That's an increase of 14 since yesterday's numbers. Going down our list here, hospitalized are 8, discharged and recovering 1, never hospitalized 9, recovered 47, and unfortunately deceased 1.
Thank you. We did receive a couple of questions ahead of time, so we do want to mention those now, and they were both related to, I believe, potentially Scott County, so we can have Ed look at some of these. First question, we're getting questions from families of workers at manufacturing plants where they believe people have had COVID-19, but the plant keeps operating. Is there a safety issue? Can you change orders inside of the plant or order changes inside of the plant? Ed, do you want to describe how public health, most likely on both sides, addresses this?
Well, it's public health's role to follow up with individuals who test positive in our county. And if during the follow-up we determine that an individual may have been at work during the onset of symptoms, we'll contact the employer to determine if the plans they have in place for responding to COVID-19 in their business. We'll also answer any questions that they may have as they make decisions on how to respond. Each case is going to be different, and our responses and guidance on how to handle a positive case will be very much dependent on those circumstances. Where in the facility did the employee work? Was the employee in close proximity to others? Was the employee symptomatic when the likelihood of spread is the greatest when at work? Overall, businesses are encouraged to carefully balance the need to disclose information on ill staff or those who may have had close contact and maintaining the privacy of employees. We also must remember that COVID-19 is spreading in our community. There are people in our community who likely have it, but haven't been tested and may not need to be tested if they can just recover at home. That's why measures such as maintaining 6 feet between one another, washing your hands, sanitizing your work areas, and staying home as much as possible are vital. As health departments, we do not have the authority to require businesses to respond in a particular manner when it comes to how they handle COVID-19 or other communicable diseases. This includes their communication with employees. We encourage employers in the community to have regular communication with their employees on how they intend to or are handling the spread of COVID-19, which may impact their business.
Nita, do you have anything to add for how Rock Island County has been handling any of these similar questions or concerns regarding a case in possibly a larger factory setting?
Sure, I would agree absolutely 100% with everything that Ed just went over. And our nurses are on the phones with any places that are having issues or positive cases, and they are giving great guidance, cleaning and disinfecting information, and proper precautions. And I will say every place of business and others that we have been speaking with has been very receptive, and those places have been very proactive, and they are trying to do the very best they can.
Thank you. The second question we received ahead was this. The Scott County Conservation Board says the Health Department recommended the Park Board ban Illinois and other out-of-state golfers from playing at Glens Creek. Since Rock Island County and Scott County have virtually the same number of COVID positive cases, doesn't that send a signal that Iowa golfers are at a similar risk to staff than Illinois golfers? Ed?
Well, the staff at Glens Creek reported a significant number of out-of-state golfers were from the Chicago area. Golfers from Rock Island County weren't the only out-of-state patrons golfing at Glen Creek. We know there's community spread in Scott County and many other parts of Iowa. We also know that in some of our neighboring states, the community spread is even higher. Governor Kim Reynolds provided guidance that encouraged anyone who has traveled out of state to self-isolate for 14 days in order to ensure that an individual traveling back from areas with higher community spread wouldn't accidentally further transmit the virus to our community. Recommendations of the Scott County golf courses were to align with the governor's recommendations in regards to the increased risk that's caused when individuals from other states are coming into our community. During this point in the pandemic, it's not in our community's best interest to be drawing people in from other areas in the Midwest when staying home is the best protection. I'll also note that Illinois has a stay-at-home order, and we think it's incumbent upon Illinois citizens to observe that order and not try to circumvent it by going to another state to play golf.
Thank you. Now we'll go to the questions in the chat. The first question, when you look at Iowa's map of COVID-19 cases, the eastern half of the state has more than half of the total number of cases. Is there a reason for that? Ed, do you want to start with that?
Well, Scott County is the third largest metropolitan metropolitan statistical area in the state, behind Lynn and Polk. Polk, Lynn, Johnson, and Scott County have at least a third
Eastern Iowa
of the population in the state, so you would expect to see a larger number of cases here. Plus, you'll remember that the first cases in Iowa were in Johnson County.
How concerned are you that each county now has a death and positive numbers seem to be jumping? And is it especially important to take precautions now? Nita, do you want to start with that?
Sure. I think that just proves what we've been saying for the last few weeks, that COVID-19 is out there in our community. Again, some people can be asymptomatic, so they are showing no signs of illness. So you really need to take all those proper precautions that we've been talking about for weeks now: frequent hand washing, covering coughs and sneezes, stay home as much as possible, stay home when you're sick, and make sure you have that social distance of at least 6 feet between you and others.
Thank you, Nita. Another question, this is for Rock Island County. Can you confirm the identity of the death in Rock Island County? We've been told by those who knew him, but would like to ensure the person we've been told about matches the information that you have.
That would be a violation of privacy laws, so we will not be identifying individuals.
Thank you. With Chicago being less than 3 hours away and considered a hot spot, are we seeing an increase of numbers because of our proximity to Chicago? That may have been related to the question and answer we gave earlier, Ed.
It's exceedingly difficult to know where a particular case originated, but it's certainly not good having Chicagoans coming into our community and potentially spreading the disease.
Next question looks to be Iowa specific as well, Ed. Are the restrictions and guidelines Governor Reynolds has put in place equivalent to a shelter-in-place order? And would a shelter-in-place order be more effective?
The restrictions put in place by the governor are different from other states. There's a lot of difference between the particular state shelter-in-place order. For example, Iowa's restrictions don't close golf courses while Illinois does. I can't go down and compare point by point, but the governor has been increasing the restrictions according to a rubric that's being used by the Iowa Department of Public Health, and they continue to keep a close eye on the situation.
There's a second portion to this question. Is it counterproductive to have Iowa not have a shelter-in-place order while Illinois does? Nita, have you seen any thing that you would want to share on top of this part of the question?
Yeah, I would just say that many times Iowa and Illinois are different in what the state does. So this really isn't anything new, and it's just having to deal with this particular disease. But certainly, even if people are in Iowa, we have been saying, you know, stay at home as much as you can. Don't go out unless you need to for essentials. So people can still abide by those same guidelines without, you know, being the governor's decree.
Ed, would you like to add to that?
I think Nita's correct. Perhaps talking about whether one state has a shelter-in-place order and another doesn't is missing the point. We've been saying it all along. Stay at home. Essential trips only. Social distancing. It ultimately is personal responsibility. If Illinois has a shelter-in-place order and we're getting Illinoisians coming and playing golf in Iowa, they're not exercising that personal responsibility that we've been encouraging all along. That's what's going to keep you safe. Stay at home. Essential trips only. Social distancing.
Thank you. The next question, with the two health departments working across state lines together, is Rock Island County seeing challenges that maybe Scott County isn't regarding COVID-19? Nita?
I don't believe so. And just so everyone is aware, Scott County and Rock Island County regularly work together. We work together on a daily basis with many different programs that we have. So this really isn't anything new, and we all recognize that this illness is out in our community. It's not going to stop at the river. So I don't see it as a barrier at all. I think it's a great partnership, and, you know, we all work together as one community.
Thank you, Nita. Please type any additional questions into the chat. Thank you all for your time and for your questions. We look forward to continuing to connect with you on these calls in the future, so please be looking for information to come from us soon. Have a good day.